Okay. Bismillah ar-Rahman ar-Rahim. Wassalatu wassalamu ala ashraf al-anbiya wal-mursalin. Good day. I would like to welcome you. This is Dr. Hani Al-Mugti, Preventive Medicine Consultant. It is a pleasure to be with you today. Thank you for Asian Conferences in Science and Technology and Medicine for this opportunity. My talk today is about our research project, the physical exercise skill level among the elderly who attend primary healthcare center in Saudi Arabia and Qatif region. This is the project. The author of the project is Dr. Hani Mugti and my colleague Dr. Majed Alosaimi. Chronic disease, as you know, are considered one of the major public health problems in Saudi Arabia. Chronic diseases are estimated to be 78% of all death. The KSA proportion mortality rate considered that the cardiovascular disease is the highest rate of the causing of death by 37%. It's alarming. It's signaling for the public health awareness about the health lifestyle modification that can reduce or decrease, or preventive measure that can help to decrease the incidence cases of cardiovascular disease and other non-communicable diseases. Age factor is considered one of the non-modifiable risk factor for chronic disease. Of course, practicing the healthy lifestyle, like doing regular physical exercise, can maintain and promote the health of the individuals in general, and for the elderly or for the old people, of course. So our research was to assess, it's like an assessment study to assess the physical exercise level among the elderly populations. We use cross-sectional study designs, and we use actually the valid and reliable one of the questionnaires, assessment questionnaires, called the physical activity scale for elderly. So our objective was to measure the physical activity level in elderly, in addition to questions about the barriers and the motivator regarding physical activity. We need to know that we need to highlight some of the motivations, the barriers of doing physical activity that may will help us to designing a public health program to motivate these targeted populations, of these group of population that need such programs by side, if they diagnose, of course, of chronic diseases, by side the prescribed indication. So our study is conducting among elderly Saudi population with age more than 60 who were visiting the primary healthcare center in Qatif. Our results show that we have the sample size was 250, and the results showed that our age range from the 60 to up to 98. The mean age was 66. We want to have the gender ratio from male to female. A majority of them are married, and their occupations were, most of them, as a housewife for the female, and the governmental work for the governmental, and retired for the male. Level of educations, it's considered good for the intermediate and the plus, secondary and the college and above. A monthly income is majority of them is more than 5,000 riyals. It's like 2,000 US dollar. The physical activity level is measured by using the physical activity scale for elderly. We showed the result showed that the main of the score was 91 for the 95 for the male, and 82 for the female. and the total score was 91 plus minus 10 for as standard deviation, and there is no statistical significance between male and the female population in our group. The motivation factors was disease management. Some of them already diagnosed by the chronic disease, and that's make them to start to change their life for the positive changing for to be more healthy and physical active, to maintain and to prevent the complications of diagnosed chronic disease. The barrier why they are not, some majority of them cannot do the physical activity because the poor health and the pain disease aggravated by doing the exercise is the major barrier factors, because getting old, they cannot do the regular exercise. Some of them, they had negative pressure, the negative experience. They didn't do the physical exercise before. This is one of this is one of the barrier factors. These guys may need to consulted by the specialist in the physical exercise medicine to help them to do the specific physical activity for them. There is specific physical activity for these guys. They cannot do the regular physical activity like other like a younger age or the age of no communicable or known diseases. Our conclusion: the physical activity scale for elderly score is an important instrument for clinician for determine the health status of elderly and for prevention, protective strategy and planning, which is lower in our result in comparison with other studies. So we can use this scales as the benchmark in different countries to comparison between our country population and the other population in different countries. So the nutrition, the exercise, and the other lifestyle medicine, it's a good protocol, a good pathway to maintain and to promote our health program. Our study, it's just the kickoff start for the following or other study to do like intervention study to how much this physical exercise can help to maintain and decrease the different parameters of the health and elderly populations. Thank you very much. This is Dr. Hani again, and I would like to thank the conference for this opportunity, and thank you very much for the Asian Conference of Science and Technology and Medicine for this opportunity. Thank you very much.